Riverside Healthcare puts the health and wellness information you need well within reach.
We are joined by Dr. Arshad Yousuf. Dr. Yousuf, thanks for joining us today.
Oh, thank you very much for inviting me. It's an honor and privilege to be here and to be with you and at this hospital.
Well, we appreciate all that.
Thank you.
And I'd like to start by asking some personal questions, not too personal, but tell us a little bit about your family and
Sure.
where you, maybe first start with where you grew up.
Well, I was born in Pakistan and I had my medical education in Pakistan. Came to U.S. about 20 years ago. Got trained in Jones surgery first in New York and then went on to Cleveland Clinic where I had my training in cardiothoracic surgery. I've been in practice for about 15 years and currently I'm a faculty at University of Chicago.
Yeah.
And for the last 1 year, we have been coming to Riverside, and we have a very good relationship with Riverside, and we have been coming over and providing care to the patient in Kankakee area, and it's been a pleasure enjoying taking care of the patients, working with the physicians in this area.
Yeah.
And the experience have been wonderful.
Yeah, well, I know Riverside is very glad to have you, as are the patients in the area. You've done some great work in the time you've been here. But family, do you have family?
Thank you. Yeah, me and my wife live in Frankfurt area.
Wow, very good.
And we have 2 kids.
Yeah.
They go to college. My daughter has just been accepted to University of Indiana to
very
do
good.
law.
Oh, very good.
And my son plans to go into medicine, so he still has
wonderful.
some ways to go. He's
Yeah.
in college as well.
Now, speaking about the decision to go into medicine, what prompted you to go into
Well,
medicine?
I'm from a very big family. You know, I have 3 brothers and 2 sisters. And to everybody's surprise, everybody is physician in my home.
Wow.
Yeah. So my oldest brother is a pediatrician. Then we have an ophthalmologist and a gastroenterologist. So my father is not a physician at all. But, he never pushed me to be a surgeon. But I just had the feeling that there should be a surgeon in the family. So that led me to a surgery residency, and during my training, I had the chance to work with some of the top surgeons in the country, and thought about going into cardiac surgery.
Yeah.
And it's been a wonderful experience ever since.
So the family got a surgeon out of the deal. So you have a lot of areas represented.
That's true. And my 2 sisters, I have a sister, she's a radiologist. And I have a sister, she's a pulmonologist. So it's a physician in the whole family.
Well, at family gatherings, must be interesting conversation.
We try not to talk about medicine. Otherwise, with difference of opinion, we'll get into a fight.
We wouldn't want that. We're not going to fight today. I promise you that.
Thank you.
But as a cardiothoracic surgeon, you surgery perform in the heart, but also the chest and other areas. So it's not just heart surgeon. Talk a little bit about some of the variety of surgeries that you do as a cardiothoracic surgeon.
So at Riverside, we provide cardiovascular and thoracic surgery. That means anything to do with heart. It could be a blocked artery giving rise to a heart attack. And patients present to our hospital with chest pain, and they're usually seen by a cardiologist who do an angiogram. And then when the patient is referred to us, we do what's called as a bypass operation. Some patients have a leaking valve in the heart, and those present with shortness of breath. They have difficulty breathing, and those needs to be fixed. So that requires valve repair or replacement. And sometimes the arteries from the heart get swollen. We call it aneurysm.
Okay.
And the normal size is about 1.5 inches. It becomes 2.5 inches. Those arteries needs to be fixed, called an aneurysm repair. So those are all done at the Riverside Hospital. Then the thoracic part is to do with lungs. If somebody who's been a smoker and unfortunately presents with a mass in the lung that turns out to be a cancer, that needs to be dealt with surgery that will require removing a part of the lung called a lobectomy. And sometimes they treat people with pneumonia and we call as pus collected around the heart or the lungs called empyema. That needed to be treated, and we are doing what we call as minimally invasive surgery. Without doing a thoracotomy, we can make keyhole incisions and put a little camera and clean up infection. And the third part is vascular surgery, and the blood vessels supply blood to the brain and to the lower extremities. And because of smoking or other reasons, if those get blocked, some of the patients present with a stroke and because the arteries to the brain have been clogged off. So those arteries needs to be cleaned up. That will require surgery, and sometimes the arteries in the lower leg gets clogged off, so that needs bypass in the leg. The other part is we call as aneurysm. When the arteries become dilated, it can dilate in the abdomen as well. And today, in partnership with cardiology, Dr. Patel, we did what we call as EVAR, which is endoscopic repair of aneurysm, in which we put a stented graft through the groin and repair an aneurysm in the abdomen, which is the abnormal dilatation of an artery that supplies blood.
So you work with the invasive cardiologist to perform
we have a heart team approach, meaning we have cardiologists, cardiac surgeons, nurses, anesthesiologists. We always discuss cases, and we do what's best for the patient.
Sure, yeah. And to back up a little bit, you mentioned leaky valves and then someone in the heart. If a patient is not feeling right, maybe you mentioned fatigue or some other things, generally, oftentimes they would go to their primary care doctor to get a diagnosis, who might then send them to a cardiologist. Is that normally kind of how the procedure process would go?
This is what normally happens, and sometimes it's not easy. And I remember a patient from Watsika. He presented with shortness of breath, and they have a leaking valve, and the blood backs up into the lungs. So the lungs appear like they are full of blood. Sometimes they are diagnosed as pneumonia. And this patient shows up to the emergency room. He was initially treated with antibiotics, but the doctor was smart enough to know that it's out of his limit. Let's send the patient to Riverside. So he shows up at our emergency room. We did an echocardiogram, which is ultrasound of the heart. We put a little camera close to the heart and we take pictures. We found one of the valves has ruptured, and the blood was leaking back up into the lungs. So what they initially thought it was pneumonia. It was not pneumonia. It was pulmonary edema, meaning the lungs were full of blood. So we went in and fixed his valve, and he did great and went home, and he's doing great now.
Really, with all the things that you talked about, there's quite a variety of procedures that you have the potential to do. And let's talk a little bit about how the patients, from the range of those procedures, what the patient might expect, say in that valve surgery. And you've been in medicine a few years now. Just in the time you've been, you've probably seen a difference in how you're performing these and the recovery time for the patient, the protocols for recovery, how much time they can expect to be laid up, if you will. So let's talk about a valve surgery and what might a patient expect from that kind of procedure.
Well, if a patient comes to my clinic and presents with a valve which is either leaking or is not opening completely, and I try to explain to them that heart has 4 chambers and they're connected through a double door. And if the door doesn't open and so the blood doesn't flow through the heart, that needs to be fixed. Or sometime if the door opens in both directions, and that's we call it a leaking valve. So they come for surgery in the morning, and they show up at 6 o'clock. 7:30, they go to the operating room. We start around 9. It takes about 3 to 4 hours. So by 1 o'clock, we're done with surgery. They go to the intensive care unit. They're still sleepy. We wait 3 to 4 hours. When they're fully awake, the breathing tube comes out. The next morning, they're in a chair, starting to walk. The following day, they're out of ICU. And the tubes come out, and in 3 to 4 days, they're ready to go home. Now, depending on the home circumstances, if they live by themselves, not much support at home, then we suggest they go to a small rehab, which is available at our hospital till they're strong enough to go home. Some patients want to go home and go back to their beds, so we try to arrange a visiting nurse service to go visit them a couple of times a week. So it usually takes about 4 days in the hospital. Plus, the recovery period is about 4 weeks. So even when they go home, sometimes they feel weak and tired. So it takes about 4 weeks before they get back to normal. The only precautions I tell them is not to drive. If they get into an accident and the front of the chest hits the steering wheel, that's not good. Or lift anything heavy. Other than that, they can do anything. And some of them bounce back so well that in 2 weeks they want to get back to work and get back to their life. And so, but normally it takes about 4
Yeah.
weeks.
But the prognosis after those 4 weeks for most patients is really a normal life again.
Oh yeah, yeah. I mean, I'll tell you this story about another patient this weekend, not at Riverside or Watsika, at another hospital, had the same leaking valve. And if treatment is not provided to the patient, they can expire. And
Mhm.
this unfortunate patient was in a different hospital. I was called over the weekend, and then I got another call within 10-15 minutes. The patient passed away.
Mm.
So this is serious disease,
Yeah.
a leaking valve, and this needs to be treated aggressively.
Yeah.
And the only unfortunate treatment is surgical.
Yeah. So let's talk again about the symptoms. What should people look for as their health might change a little bit that could be alert them to look into this?
The valve can either get stenotic, meaning the door doesn't open completely, or it can leak. It can happen over a period of time. It can happen, and so they notice progressively they're getting more tired, or they're getting more short of breath, or it can happen suddenly. Suddenly they just can't breathe. So if it happens suddenly, that's life threatening.
Mhm.
So they should go to emergency room right away. And then the emergency room should assess the patient and see if they have the capacity to take care of such a patient. If not, they should be flown to a center like our
Mhm.
hospital. If it happens over a period of time, then they have more time. They can go to the primary care physician. From there, should be referred to a cardiologist, or at least get an echocardiogram, which is
Mhm.
doing an ultrasound of the heart to see how the heart function is and valve function is,
Yeah.
and just take it from there.
Sure. That always makes me think of the importance of getting regular checkups. So if there's a change in your condition or a change in some of these things from year to year, your primary care doctor is going to see that, notice that, and it could alert you to some of these things. Is that good advice?
That's very good advice. Plus, in this area, I've noticed some patients that put off going to a doctor,
Hmm.
and that's common, which
Yeah.
is unfortunate, because if they're not feeling well, they're being tired for a while, short of breath, they shouldn't put off going to a doctor. I think
Yeah.
it's time, and most almost all primary care physician in this area are very good.
Yeah.
So if they go, I'm sure they get the proper care.
Yeah.
But they should not put off going to a doctor.
Yeah.
That's very important,
Yeah.
particularly in this day and age when we have all this care and treatment available just next door, and not to use it is kind of unfortunate.
Yeah, that makes me think of a couple cases I know of that you've been involved in since the time you've been here at Riverside. A couple patients, and I hope I'm going to say that the procedure right, a descending aorta, that a very emergent situation. That fortunately you were here, able to take care and treat a couple of these patients who really wouldn't have survived otherwise. And I know after that you spoke to the idea of you being in the community, having these services available here, where in some cases if they're not available that locally, it could mean the difference between life and death. It's got to be very rewarding for you to be in that kind of position.
It's kind of good that you talked about it, because I did meet with a couple of folks from University of Chicago today, and they were looking at what we have been doing here, and they were kind of surprised because in the past those patients were flown to University of Chicago. And I remember at least two such patients. One was a dear friend of, he's become a friend now. He shows up in the emergency room with the aorta, which is the big artery from the heart, takes blood to the whole body. That had ruptured. And luckily, the rupture was very contained. If it would have ruptured, he would have died. Now I made it to the emergency room, and he looked like a very normal, healthy, and nice family. And we were able to do an echocardiogram, which is again the ultrasound of the heart, and a CAT scan, CT scan of the chest. We found that rupture. We took him to the operating room right away. He had a great repair, and he did fantastic. He continues to do well. That's one patient. Another one was an older lady who had an aneurysm, which is a slowly the artery had become bigger, and shows up with one of the aortic valve on which the artery sits that had become tight. It's called stenotic, didn't open completely. So she needed that valve replaced and also the ascending aorta repaired. Big operation in an older lady. She did very well. We operated here, and she's doing great. So, these are a couple of cases which were very challenging, but, I'm so happy we have at Riverside, we have the facility, the not just physician but nursing wise, anesthesiologist support from the administration and the people in the operating room, the equipment and everything. And the other thing I noticed that a lot of patients, they don't want to drive north.
Sure.
And they're happy that all this is available here, cutting edge, top notch services. And I'm happy for them, and I'm happy that we are able to do this at this institution.
Sure. Well, it makes a difference, I'm sure, for the patient. If their family's able to be close and come and see them, it has to help their recovery and just help the whole process for them.
Sure.
Yeah.
It's very. They're very thankful at the end, and I see them all the time. They coming for rehab, which is after heart surgery. They go through a process of exercise and training again, and I see them every day. And it's nice to see them doing well. People who were brought here in ambulances, on a stretcher, now walking like normal people. They've lost weight. They're in great shape. It's good to see that, and they're so grateful, so thankful.
And I hope when you get together for family reunions, you tell all your brothers and sisters about those great stories.
Well, we try not to talk about medicine because they all come from different specialties, but we do talk once in a while.
Well,
And
those are rewarding stories to tell them. They can't argue with that kind of.
That's
that
true,
kind of news.
and we've had a couple of videos of patient testimonies, and I did send to my brothers and sisters, and they were very proud.
Very good. Dr. Yousuf, we appreciate your time today. The time's gone quickly, but we appreciate you joining us and sharing all this with the folks who are listening to the podcast.
Oh, thank you very much. Thank you for your time. Enjoyed it.